Good day, ma'am. I'm Samantha Paclaon, your caregiving student from Philippine Women's University. For verification, ma'am, may I know your full name and your birthday, please?
Sarah Mary, August 11,
How many weeks pregnant, ma'am?
25 weeks.
The procedure that we are going to do is Leopold's maneuver. Leopold's maneuver is abdominal palpation to determine the position, presentation, and engagement of your baby inside your uterus, and it usually performs at 24 weeks of gestation. Instruct the pregnant woman to empty her bladder. How's your feeling right now, ma'am? Good to hear that, ma'am. Ma'am, do you want to urinate first before we start the procedure so that there will be no discomfort? First maneuver is the fundal grip. It determines what fetal part lies on the fundus. Position the woman into a dorsal recumbent. Supine with knee flex. Ma'am, allow me to lift your shirt and expose your belly so I can start the procedure. Facing the client and perform a triangle. Warm the hands before the procedure because cold hands can stimulate contraction. Palpate the abdomen using both hands. Use the palm, not the finger. If it's round, hard, and firm, it's fetal head. If it's too small rounded part with angular nodulation, it's buttocks. For the fundic height measurement, using a tape measure in centimeters from symphysis towards to the fundus, it measures 25 centimeters. The second maneuver is the umbilical grip. It determines the fetal back and the small fetal parts. I will pacing the client, left hand steady, right hand palpating. If it's smooth, hard, and with resistant surface, it is fetal back. But if you palpate with small irregularities, it's fetal parts. The third maneuver is the pollex grip. It determines the engagement. Using the thumb and the index finger, grasp the lower portion of the abdomen just above the symphysis pubis. If the presenting part is still movable, it is floating. If the presenting part is not movable, it is engaged. The fourth maneuver is pelvic grip. It determines the attitude. Facing the foot of the client, palpate the side of the uterus, going to the symphysis pubis. If the brow is the same as fetal parts, it is flexed. If the brow is the same as fetal back, it is extended. Procedure is the fetal heart rate. The normal fetal heart rate is 120 to 160 beats per minute. During the second maneuver, the fetal back lies on the right side. So, using my stethoscope, I will place it in the right side to get the fetal heartbeat. the result of your assessment. For the first maneuver, the head lies on your fundus or in your upper abdomen. For the second maneuver, the fetal back is in the right side. For the third maneuver, the baby is floating because the presenting part is still movable. For the fourth maneuver, the baby is flexed because the brow is the same as the fetal parts. The fundic height of your baby is 25 cm. The fetal heart rate is 140 beats per minute.